This time, I'd like to recognize Mr. Miller, the senior Democratic member of the committee, for his opening remarks.
Thank you, Mr. Chairman, and thank you for having this hearing. I want to join you in welcoming Secretary Sebelius to the committee. From educating our youngest children in Head Start to ensuring seniors access to health care and Medicare, your department administers programs that have unquestionably made our families and communities healthier and our country stronger. In recent months, we've seen an unprecedented attack on these programs that help millions of American families. While we must address our nation's long-term deficits, the budget priorities pursued by the Republican majority have put much of the sacrifice directly on the backs of children and seniors. Cutting 130,000 children from Head Start isn't about rebuilding our economy. The repealing of historic health care reform law won't help families and businesses get costs under control. You and your agency, Madam Secretary, have primary responsibility for implementation of the Affordable Care Act. A year after its enactment, the reform bill is still doing the right thing. It is the right thing to do to help families struggling with affordable coverage. It is the right thing to do for businesses crushed by skyrocketing premiums over the last decade, and it was the right thing to do to finally end the worst abuses of the insurance industries. The Affordable Care Act also makes significant strides in combating fraud and abuse in the Medicare and Medicaid system, and it includes key health care cost controllers identified by top experts as critical to getting costs under control without rationing care. And this is part of keeping the bargain and the promise that this country made to our nation's seniors. And it's a promise and a bargain that this nation must keep to our seniors. However, the same cannot be said about the Republicans' budget. They achieved savings not by making Medicare work better, but by shifting costs onto seniors. In fact, under a report we released this morning, seniors would have to shoulder approximately $6,400 more in health care costs in 2022. The typical 65-year-old in 2022 will spend half of their Social Security on health insurance premiums under the Republican budget plan, and that cost increases with each passing year. Using the CBO numbers, the Center on Economic Policy Research has found that to buy Medicare equivalent policy under the Republican plan, the median 85-year-old in 2050 would have to spend twice their annual income. In this committee, we should be concerned about what this means for workers today. Based upon further analysis by the Center, which I submit for the record, the 54-year-old today would have to save an additional $182,000 over the next 11 years just to pay for the increased health care cost under the Republican budget. This is over and above what they're already putting away every month in their savings, in their 401ks, in their retirement plans. So these workers will have to find around an extra $1,000 to $1,300 a month to put in their IRAs or their 401k plans. And that is contingent upon the market not crashing right before they retire. This committee has been concerned for years about the sufficiency of workers' retirement plans. In 2007, before the recent crises, the Census Bureau found that half of all the workers had no retirement savings. In 2010, the Employee Benefits Research Institute found that the average retirement savings shortfall was over $47,000 per individual, and all of that was counting on Medicare. So how do these workers find another $182,000, especially since for middle-class workers in this country, wages have essentially been stagnant since the 1970s, and labor protections for workers who try to organize and do better for their on the job for their families and for their communities, those ability to organize are now under attack. Under the Republican plans, seniors will go into debt, and they will be forced to sell their homes they've spent a lifetime paying off, and they'll have to rely on their children just to pay basic medical care. This is not what anyone envisioned as a dignified retirement. This was not the bargain. This was not the promise that this nation made with its seniors. And that clearly understanding the need for additional reforms to make sure that Medicare is sustainable for seniors in the future and sustainable for taxpayers. I'm very encouraged to see that as the Republican negotiators go to the White House today, they're reconsidering the idea that they would split Medicare, that they would put the 65-year-old in the jeopardy that I had outlined under the economic policy study, and they would put this burden on the savings of middle-class Americans today. And they also have the ability, as they go to the White House, to think about whether or not Medicare is going to be included in the discussions around the debt limit. It sounds like they're reconsidering that. I hope they are. They can also understand that they can build on the $1 trillion, about 700, was a little over $700 billion that they've adopted in Medicare savings for their budget that are in the Accountable Care Act. And so hopefully we can continue to build on those kinds of savings that come from bending the cost curve for health care for seniors in this country and for the cost of the Medicare program. Again, I welcome you to the committee and thank you so much for your service to our country.